especially to compare the effective operations control drugs administered and
Bismillahirrahmanirrahim. We have completed the drugs which are used in hypothyroidism. Now we start the drugs which are used in the hyperthyroidism. Hyperthyroidism is a condition in which there is the increased level of T3 and T4 in the plasma. And as this hormone is hypermetabolic in nature, so it will increase the BMR of the human body. This is increase the cardiac heart rate, cardiac contractility. So we have to decrease the synthesis of thyroid hormone. So if you see this picture, this is the picture of thyroid follicle in which the iodine is transported from the plasma into the thyroid follicle, and by the enzyme peroxidase, the thyroid iodine is combined with the amino acid tyrosine in the thyroglobulin and form the thyroid hormone. First, monoiodothyronine and then two monoiodothyronine combine to form diiodothyronine. When one mono and one diiodothyronine combine, they form the T3. And when two diiodothyronine, they combine, they form the T4. So the drugs which acts as synthesis inhibitor, they act at this level. Then the drug thyroglobulin is undergoes proteolysis, and then the T3 and T4 is released. So some drugs act at this level. They inhibit the proteolysis and release of the thyroid hormone. And the drug, when the hormones released into the bloodstream, after performing its metabolic function, they recycle again into the thyroid gland. So some drugs, they act by inhibiting the reuptake of the iodine into the thyroid follicle. So this is the classification of the drugs which acts as anti-thyroid. Hormone synthesis inhibitors, they inhibit the synthesis of T3 and T4. The drugs which are comes under this heading, they are propylthiouracil, carbimazole, and methimazole. And when the drug thyroid hormone prepared, it will be released. So some drugs, they called hormone release inhibitors, means they inhibit the release of T3 and T4 into the bloodstream. These drugs are called iodine, iodides of sodium and potassium, and organic iodides. These drugs are hormone release inhibitors. Then some drugs, they causes the destruction of the thyroid tissue, and they are called radioactive iodines. The radioactive iodine 131, 125, and 123, they are used as destroying the thyroid tissue. Then inhibit ionic trapping, and these are called ionic inhibitors, and they are perchlorate, pertechnetate, and thiocyanate. So this is the drug classification of the drugs which are used in hyperthyroidism. The structure, activity, and relationship of the drugs. three general categories into which most of the agents can be assigned. One is the thiouracil, which includes all the compounds currently used and aniline derivatives, of which the sulfonamide make up the largest number. Then polyhydric phenols. These are the resorinol, which have caused goiter in humans when applied to abraded skin. Thioamides. This drug comes under the category of synthesis inhibitors. Inhibit the hormone synthesis by inhibiting the enzyme peroxidase. When there is no oxidation of the iodine, there is no formation of the thyroid hormones. Propylthiouracil also inhibit the peripheral deiodination of the T4 and T3. And methimazole is drug which is more potent and have longer duration of action than the propylthiouracil. Propylthiouracil have slow onset, 4 weeks. Thiocarbamide group essential for anti-thyroid activity means this thiocarbamide group is present in the methimazole and propylthiouracil, and this is the group which have the activity which block the peroxidase, and in this result there is no formation of the T3 and the T4. So mechanism of action of these drugs is they inhibit the peroxidase enzyme. So they inhibit the synthesis of the T3 and T4. Pharmacokinetic. These drugs are taken through the oral route of administration. They have wide distribution, and they propylthiouracil among the synthesis inhibitors have the high plasma protein binding. Their half-life is 10 hours. How the drugs metabolized? The drug metabolized in the hepatic cells and also in the thyroid. The carbimazole is a drug which first converts an active metabolite, methimazole, and then produce its effects. The drugs, carbimazole, have the ability to cross the placental barrier, and when it crosses the placental barrier, it have also crossed the breast barrier, that is secreted in the breast milk also. But propylthiouracil have less readily excreted into the breast milk. Their route of excretion is the urinary route of excretion. So this is the pharmacokinetic of the thyroid synthesis inhibitors. First, we discuss the classification, then mechanism of action of the synthesis inhibitors, then what is the pharmacokinetic of synthesis inhibitors. Now we are talking about the adverse effects. When patient receive the anti-thyroid drug, that is the synthesis inhibitor, they may be suffered from maculopapular rashes, gastrointestinal side effects like GI upsets, gastritis, and may it affects the joints and cause the arthralgia. These drugs, as they are anti-thyroid in nature, so they can cause the hyperthyroidism. Rarely these drugs are causes exfoliative dermatitis, vasculitis, and lupus-like reactions. As this drug is metabolized into the hepatic cells, so there is severe hepatitis can be observed with the administration of the propylthiouracil, and reversible but dangerous side effect of the Propylthiouracil or carbimazole is the agranulocytosis. The clinical indication uses of the synthesis inhibitors, they are given into the non-operative therapy of the hyperthyroidism. Means when the surgery is not indicated, then you treat the hyperthyroidism with the help of medical treatment like synthesis inhibitors. In perioperative periods means patient is preparing for the surgery, and during this period with the administration of the thyroid inhibitors, thyroid synthesis inhibitor, along with the iodides. Thyrotoxic crisis. Thyrotoxic crisis is a condition in which there is exacerbation of the thyroid secretion. And this crisis is treated with the synthesis inhibitor along with the beta blockers and larger doses of the iodides. Means thyrotoxic crisis needs multiple drug therapies. Along with thyroid synthesis inhibitors, there should be administration of beta blockers, and the large doses are the iodides. Iodine and the iodides. This iodine is the oldest and the fastest acting agent, and paradoxical effect on the thyroid gland. Iodides block the organification, means thyroglobulin and the containing iodotyrosine in the thyroglobulin. This process is called organification. Means when iodotyrosine accumulate in the thyroglobulin, this is the organification. When you block the organification, there is no storage of the thyroid hormones, and when there is no thyroid hormone, there is no release. Through inhibition of the proteolysis, iodine block the organification. When there is no organification, there is no release, and it also inhibits the proteolysis of thyroid. When there is the decreased proteolysis, there is the decreased release. Means these agents are called release inhibitors, thyroid release inhibitors. And as these agents causes the inhibition of the release, that decreases the size and vascularity. So these are the iodine and the iodides. They are used alone and may be in combination with the synthesis inhibitors and the beta blockers. It is the ideal agent for the treatment of severe thyrotoxicosis and preoperative treatment. Anti-thyroid effect is not for long term as gland escapes from its effect, and thyrotoxicosis may return. Anti-thyroid effect means the drug will not produce its effects on long-term basis. The patient may have escapes, means period in which the effect of the drug is not observed. When there is no result of the administration, the period is called escapes. Means in this period there is increased level of T3 and T4 in spite of the administration of the iodine and iodides. This is called escape. Excess iodine, when you are giving the iodine in large amount, it interferes with the expression of sodium iodine synthetase on the cell membrane and attenuates thus TSH and cyclic AMP-induced thyroid stimulation. Interfere with the iodination of tyrosine and thyronyl residues of the thyroid. This is the function when you are giving the iodine in excess amount. Then the clinical indications of the iodine and iodides. Pre-operative therapy means these are the drugs they are given in the patients who are waiting for the surgery of thyroid gland to treat the hyperthyroidism, and these drugs are given in combination with the thiourea or the synthesis inhibitors. Thyrotoxic crisis is also an indication of the iodine. They are given in the combination with thiourea derivatives, and this drug is also given as a prophylaxis treatment of the goiter in the areas where the endemic goiter is common. These drugs limit the potential damage to the thyroid gland by radiation emergency. And Lugol solution, 5% iodine and 10% potassium iodides. They are given saturated solution of potassium iodide yields a dose of 38 milligram of iodine and per dose. Means potassium iodide. And Lugol solution, these are two preparations which are given in hyperthyroid patients to treat the hyperthyroidism. The adverse reactions of the iodine. Iodine is a drug which causes hypersensitivity reactions. Means after giving iodine, patient may experience swelling of the lips, eyelids, angioedema of the larynx, fever, joint pain, critical hemorrhages. These are the hypersensitivity type of reaction towards the iodine. And iodism, which is the chronic intoxication of the iodine. Iodine have a property to get the inflammation of the salivary gland and the acne formation. These are the side effects of the administration of the iodine. Long-term uses of high doses. When you are giving the drug in high dose for a long term of period, patient experienced hypothyroidism, and along with hypothyroidism, there is the excessive growth of the thyroid tissue and results in the formation of the goiter. The chronic use of iodine is not indicated in pregnancy because this drug has chances to cause fetal and infantile goiter.
Postpartum depression.
Infantile goiter means the goiter is developed in the abdomen of the mother. In the uterine age of the patient develops the goiter because iodine causes hypothyroidism in the infant. Then the radioactive iodine, as the name indicates, this is a radioactive substance and it causes destruction of the tissues of the thyroid gland. Before we have learned about the drugs which either inhibit the synthesis of gland or they inhibit the release of the gland. But radioactive iodine is the iodine which causes the destruction of the thyroid tissue, and this is present in the patients who have goiter. Indicated in the patients who have goiter. The iodine 131 is the only isotope used in the treatment of thyrotoxicosis, while other are used in the diagnosis. Iodine 131 isotope is the drug among the radioactive iodines which is used as treatment. Otherwise, other two, they are used in the diagnosis. The administration of the iodine is as sodium salt. Half-life is 8 days. Therapeutic effects depends on the emission of the beta rays. How much beta rays are released, and they causes the destruction of the thyroid gland. Rate of emission of the beta rays. The ability of the iodine, it causes penetration of the tissue up to 0.5 to 2 mm of the tissue. And after administration of radioactive iodine, as this causes destruction, first the cells undergo gnosis, and after gnosis, there is the necrosis, means destruction, death of the tissues. That was followed even by fibrosis. But up to this level, when therapeutic level, this doesn't cause the damage to the surrounding tissue. These agents just causes the destruction of the follicular cells. Follicular cells undergoes pyknosis and necrosis, and when there is the damage, it will be replaced by the fibrosis. And in this case, the patients may be experience the hypothyroidism and managed with the thyroid. Means there is the destruction, and that destruction causes the hypothyroidism in the patients who receive the radioactive iodines. So they should be managed after that with the thyroxine supplements. The indications of the iodine and the iodides, radioactive iodine, most common indication is the hyperthyroidism due to the Graves' disease and the toxic nodular gout. Graves' disease is a metabolic disease in which there is the excessive secretion of the T3 and the T4. And that hyperthyroidism is treated with the administration of the radioactive iodines. These radioactive iodines, they are indicated in the elderly patients who are suffering from the hypersensitivity towards the thyroids. The patients who have the hypersensitivity to the thyroids, in these patients, the radioactive iodines are given when they are in older age. Or the recurrent hyperthyroidism means you are giving the anti-thyroid agents, but recurrently patient develop the hyperthyroidism. Or the patients who have systemic diseases like cardiovascular disease, like hepatic disease, in which the contraindication towards the surgery. If surgery is contraindicated, then the radioactive iodine is the drug of choice for the patients. Average therapeutic dose is 3 to 6 mQd. That was the unit. The advantages of the radioactive iodine therapy over the surgery is, this is simple one. They are not more expensive. There is no surgical risk or a scar or injury on the parathyroid gland or the nerves. Control of hyperthyroidism is permanent. These are the advantages of the radioactive iodines. Disadvantages: permanent hypothyroidism may be result. Means if the tissue destruction of thyroid gland is more than needed, it may cause the destruction of the normal thyroid tissue also along with the disease one. So there is the permanent hypothyroidism may be result. Their response is late. This is also a disadvantage. And this drug cannot be used in pregnancy. And also, I have told you, this is the drug of choice in the elder patients. Not suitable for the young patients. Not suitable for the young patients. These are the advantages and disadvantages of the radioactive iodine. Now the side effects. Facial soreness in the focal soreness in the neck means when you applied the radioactive rays on the neck, there is the focal soreness. Hypothyroidism, I have already told you, when there is excessive tissue destruction and repair with fibrosis, it can result into the hypothyroidism. And when the drug given, when this radioactive iodine is given during the pregnancy, may cause damage to the fetal thyroid. The most important dangerous side effect is thyroid carcinoma, leukemia, and radiation-induced genetic damage. These are the worst side effects of the radioactive iodine. Then the ionic inhibitors. We have discussing synthesis inhibitor, release inhibitors, and the radioactive iodine. Now, the ionic inhibitors. Monovalent ion like perchlorate and pertechnetate, thiocyanate, nitrate, they inhibit the iodine trapping. Means the process, iodine trapping is a process in which iodine from the plasma goes into the thyroid follicles. At this level, if we block the transport of iodine into the thyroid gland, this process is called iodide trapping. And these perchlorate, pertechnetate, and thiocyanate, these drugs inhibit the iodide trapping. NI inhibitors are uncommon in use because of serious toxicity. Means these are the drugs, they have toxicity tendency. So they are not commonly used. They used in uncommon. These are effective in iodine-induced hypothyroidism. Means when excessive iodine concentration in the thyroid and it causes hyperthyroidism, you have to block the iodide trapping with the administration of the perchlorate, pertechnetate, and thiocyanate. This will inhibit the more iodine trapping in the thyroid gland. So this is very much effective in the patients who are suffered from iodine-induced hyperthyroidism. And these are some radioactive contrast media like diethylzate, rohexol, ipotate. They have also valuable in hyperthyroidism and adjunctive in thyroid stroke. They inhibit the peripheral conversion of T3, T4 into T3. T4 is not an active hormone. It should be converted into T3, then it will produce its effects. So if you block the conversion of T4 into T3, then there is the least chances of signs and symptoms of hyperthyroidism will be observed. Inhibition of the hormone release is an additional mechanism. High rate of relapses. Recurrent hyperthyroidism with the use of iodate is resistant to treatment with thyroids. Their adverse effects, anaphylaxis, precipitation of the hyperthyroidism, and the acute renal failure. Now, we'll discuss some drugs that have the tendency to cause the hyperthyroidism. Lithium is known to inhibit synthesis and release of thyroid. And lithium is used in psychotic disorders. Amidorban inhibits peripheral conversion of T4 to T3. Means if patients have received amidorban, they cause the inhibition of peripheral conversion of T4 and T3. And the epileptic drug and rifampicin, that is the anti-tuberculous drug. These two group of drugs, they have the ability to enhance the hormone metabolism. Then sulfonamide inhibit the iodination and coupling reaction. Means they inhibit the iodination of tyrosine and the coupling reaction, means formation of diiodotyrosine and triiodotyrosine should be inhibited by the sulfonamide and para-aminosalicylic acids. EAS means para-aminosalicylic acid. Expectorants means the drugs which are used in cough to expel the sputum. Topical antiseptics such as tincture iodine, they inhibit the hormone release. These are the some drugs which cause the hypothyroidism. If a patient is suffered from hypothyroidism during the period of pregnancy, and this is very serious condition, this occurs, this is the statistics, that about 0.2 to 0.4% of all pregnancies experienced the hyperthyroidism. As you people knows, the pregnancy is itself a hypermetabolic condition, and hyperthyroidism is also a hypermetabolic condition. When two conditions which are hypermetabolic, this needs extra energy and extra drugs, and there is the extra work of all the tissues in the body. Pregnancy may cause the palpitation, and hyperthyroidism is also cause the palpitation. Due to Graves' disease, toxic legumes, or thyroiditis. These are the diseases in which there is the increased secretion of the thyroid hormone. And when they present in pregnancy, they put extra burden. So there is a risk of the preeclampsia, fetal and neonatal hyperthyroidism. So medical therapy, the drug of choice, treatment of choice is the medical therapy in the patients who are suffering from hyperthyroidism in pregnancy. But because in first trimester, the surgery is contraindicated. If there is the second trimester, surgery can be done. Current guidelines suggest that a pregnant patient should be on propyl thyroidism during the first trimester due to less teratogenicity. Then switch over to methimazole due to lower hepatotoxic potential. Thyroid storm. The word storm means excessive secretion of the thyroid hormone. Thyrotoxic crisis, this is thyroid storm. Acute, life-threatening state, and it is induced by excessive release of the thyroid hormone. The treatment is supportive meds along with anti-thyroid drugs and along with the beta blockers. Iodides and hyponic acids should be given in the thyroid scope. The propranolol, the beta blocker, should be given to control the tachycardia and the cardiac arrhythmias. And corticosteroids, they should be given to decrease the release of FSH. Thank you. If you have any question, you can ask. Any question? Any question? You can ask.